Hey you guys. So I know it has been a very long time since I have made a video. Um, but I wanted to make one now to kind of update you guys on where I'm at in my program and also job wise as well. So last week I completed my clinical rotation, my second one. It was an urgent care slash like primary care office. And it was a very great experience. I think the last time I made a video, I don't know, I think I had just started the clinic, or it might have been right before I started the clinical. So anyways, so it was a very great experience. I worked with an older gentleman in his 80s or so, and he had a lot of regular clients that he saw for like addiction reasons. So he prescribed a lot of Suboxone, methadone, a lot of narcotic type medications. And then he also saw some people for primary care services. He really promoted like a plant-based, holistic type of a diet and lifestyle so that people wouldn't be on so many medications later on in life, but that they could actually pull themselves off of medications due to improvements from their diet. And he also had patients that came in for urgent reasons. So like falls, wounds and things or injuries that they sustained, UTIs, sinusitis, strep throat, back pain, just, a lot of those things. Also people come in for FAA physicals, which is basically involves anybody who's employed like through the airlines, like as a flight, I believe as a pilot, and I want to say might be for flight attendants as well, but I'm not for sure. It may just be the pilots. And then also normal regular physicals that people would come in and need. So it was a very great experience. I learned a whole lot. Still feel like I have so much more to learn, but I did learn a lot. The common things that we saw a lot, like strep throat or sore throats and things like that, and UTIs. I got way more comfortable with what to prescribe for those, what to do, what to order, when to send out a urine culture or a throat culture, what to educate patients about regarding those conditions. Also got comfortable with when to order x-rays and things like that. Now, for those who are currently in nurse practitioner programs, or even those who are not, I don't know how all programs operate, but I do know that my program, we do not get very much formal training with x-rays, really none, to be honest with you. So I attended my summer intensive for 3 days back in May, and I know I hadn't made a video anytime after that. So what we did was a lot of skills. X-rays were supposed to, like reading x-rays was supposed to be one of them. They had us purchase a book and everything for it, and we got there and they said due to time constraints and students' feedback on wanting to do other things that they felt were more prevalent, we did not end up getting any kind of training on x-ray reading. So I went into this clinical not having any knowledge at all of how to read x-rays, no kind of training or anything like that. But because this was a site that they did in fact do their own x-rays, it was a good learning experience in that regard too. Like I got to look at a lot of x-rays and identify like fractures, which is pretty simple to identify for the most part. But I also did get to look at like some chest x-rays, some abdominal x-rays and things like that. So I say that to say that my program stated that very rarely do the providers typically read their own x-rays. Well, I guess it just depends, because my facility, the providers would read their x-rays. It would then get sent out and a report would get sent back, a formal report from a radiologist. However, at the time of being seen, you know, as a patient, it was important that as a provider, you knew how to read the x-rays so that you could figure out your next course of action if they were going to get referred to like physical therapy, or if they were going to get referred to another specialist, maybe because of a fracture or whatever the case may be. So that was an experience that I got to gain, and I would highly encourage anybody whose program does not formally train them with x-rays. I would get some experience, at least learning the basic things that you would want to know on the x-ray, like chest x-rays, spinal x-rays, you know, anything, you know, to kind of gain a little bit of experience, or even purchase like a book or some kind of resource for you to have to just get more familiar, especially before you go into like a urgent care type of a setting. Let's see. But overall, though, like I said, the clinical was a very good experience. I got a lot of hands-on exposure. The preceptor that I was working with had a very extremely large patient load, which was complete opposite of my first clinical that I know you guys were aware that she did not see a lot of patients at all. So this was the complete opposite. The way that my clinicals ran with this particular preceptor, because all preceptors will be different, but just to kind of give you an idea of what to expect possibly during your preceptorship. So my provider that I worked with would let me go in, meet and greet the patients and everything before he would even go in. So I would go in, look at on their chart to see what the reason was that they were there for, and kind of do my own assessment, my own history, and get all that information necessary for me to go back and then discuss with my preceptor like what I thought my plan would be of care, and kind of just coordinate things with him. There was a few times, honestly, that I would go in and talk to the patient, and if it was something very common like a UTI or a strep throat or ear infection or whatever, I will let the preceptor know, hey, this is what's going on. This is what I see that looks like it is an infection. Sometimes he would not even come in the room, to be honest with you, unless the patient really insisted. Like, he would let them know what we were going to do, and he would give his okay, and I would send out a script, and he would let me, you know, make sure he okayed everything. But sometimes he would not go in and see certain patients, and I would just kind of give him a feedback of what was going on, because he would sometimes be busy. So I would kind of like say, hey, this is what I was going to do. Is this okay? And he would say, okay. So I got a lot of autonomy in this clinical. It is a very good experience to have that, because as a provider, as you know, most times when you become a nurse practitioner or even a physician assistant, you don't always have that, oh, I get 2 months of training when I start working, even as a new provider. So you kind of are expected to already be competent in a lot of areas and your judgment and everything. You may not have somebody there to hold your hand, so you do need to feel confident as soon as possible, which is kind of scary for me, but I gained some confidence during this clinical. And then also, so for the patients that he did see, sometimes I would say, hey, can you just double check this? Can you look and see what you see? Like if I was looking in somebody's ear or something and I felt like I didn't see nothing, I would just kind of make sure that he agreed with me with certain things. So it just was a pretty smooth flow. Got the hang of how the clinic worked, and the medical assistants that were there, you know, grew to know me because I was there all the time, multiple times out the week, you know, seeing patients and stuff, and they were very welcoming and nice. So it's always good when you have, you know, those other staff members there that are very welcoming to you as well and understand that you're a student and you're learning. Some that think you're a little more than a student and expect you to just be like, okay, you can approve this or you can do this. But it was a very good experience. Very good first major clinical. Even though this was my second rotation, it was still a very good go around, or first go around, where the provider was actually seeing a lot of patients. So, um, that's that with the clinical. My next clinical rotations will start in September, and I will be in my pediatric clinical the first half. I still have yet to secure a women's health preceptor, but my pediatric clinical will be from September to October, and I actually have two different sites. All thanks to my mom, because she works at the hospital, at a children's hospital. So she had some connections of people she was able to talk to, and to kind of help me secure some preceptors. So I'll be doing emergent care for peds. I was able to actually get that approved, even though it is an FNP program. It'll be like more in a fast track type of a area though, where the patients won't be as acute. And then I will also be in an office, so that way most FNP programs want you to get some experience with like well child visits, and like the health promotion type visits. And then I have a lot of experience already with like vaccines and things. So I think that part will be a breeze, and that may be something that I can actually bring to the practice, because I know that stuff like the back of my hand at this point, because of me working in the health department for so long. So that will be September and October. Women's health, I'm very much looking forward to that. So I hope that whoever I find as a preceptor will be great, and they will be open to students and want to teach, and take their time out to really give their knowledge, because that's an area I really am very interested in when I get done with school in general. You know, at least the contraceptive part and the sexual health related part, and stuff like that. So looking forward to that. A little bit stressed with the uncertainty of finding a preceptor. So that's a little stressful. But anyways, aside from clinicals, I have now had a little break. This is my last week of actual like lecture, school work assignments and things. And then I'll be off until September when it comes to, you know, the schooling in general. So last time though, to go on to another topic, last time I made a video, I was in the process of getting ready to start a new job, or I may have already started it. I cannot remember from the last video, but I was due to start at a inpatient rehab facility, and that was back in April. So I started there in April. It was an inpatient rehab facility seeing stroke patients, hip fracture patients, spinal surgery patients, some skull surgery patients as well, some Parkinson's patients who needed, like they were having a decline in their everyday life, so they were there for working on certain things with physical therapy and occupational therapy. And this particular floor did very intense rehab for these patients. A lot of older elderly patients and things, but they went to therapy about 3 to 4 times out the day, and they would get like maybe one day off during the week as a break to them, because most of these patients would stay in the hospital for like 10 to 14 days. But anyways, so you guys know where I was at previous. I was at the health department. I decided to make the transformation over to the hospital because I wanted to work a little bit less, and I did want to gain some new experience, and also lower, you know, the amount of days that I was working. So I went from working 5 days out the week at the health department to being working only 2 12s out the week, and I was on midnights. So it was a very great experience. I'm very thankful for the experience that I got there. However, with like work-life balance and me being in clinicals and things, sometimes I would get out of my work. I would then go straight to clinical for a few hours, which I would be exhausted. Or some of the time I would go to clinicals for a few hours, come home, go to sleep a few hours, and then go to work. And that was also kind of exhausting, although my job was so busy that most of the time I didn't get a chance to be that tired during the nighttime. And I'm kind of a night owl anyway. I always have been, but it was just a lot. Like, it was a lot, much different than the health department, of course. And the hospital life is not something that's new for me. I did start off in cardiac at a different hospital and gained a lot of experience there. It was like a step down cardiac unit, and it was okay, but I was not a fan of it there, to be honest. And then with this particular job, I was honestly not a fan of it there either. After a while, I just found myself like getting really like kind of depressed, a little stressed out, because it would be a weekend and I would be off from clinicals, but then I would have to go to work. I would get maybe one day off if I was lucky. Maybe I'll get a Friday, Saturday, and Sunday off, but a lot of time constraints and just cutting into my like personal work life. My personal like home life and all that stuff. So I was having to sacrifice like some of my weekends and stuff like that. And I was just it was depressing for me. It really was. So I got to a point where there was just a lot going on. I was in clinicals trying to balance that, and because of his schedule and things at the clinic, I kind of had to follow along whenever he worked, and I didn't have much work to do as far as my job. So I would end up there about 3 times out the week or so, sometimes more, especially towards the end. In addition to clinicals, though, my dad had a surgery, and I ended up missing work one of the days because of that. And then trying to go back and forth to my parents' house, which is about 30 something minutes away from me now, and just kind of making sure they were good, because my mom was the only one, there to help, so she had to take off a lot of work to help my dad. And he's doing better though, which is great. Like, he's doing very well. Now he's driving again because he got a total hip replacement, so he's driving and things again. He's been cleared to do that. He's going to physical therapy a few times out the week. But anyways, it just had been a lot going on. So between work, clinicals, and everything else going on, because we all have a life outside of work, right? So I decided that I was not at peace. And I decided to not stay at the job that I was at. So, I feel much better now, to be honest. It's been a burden and a weight lifted off of my shoulders with things. So I will be starting a different job next week. It's actually a home care job. It will allow me to be a little bit more flexible, and I can kind of decide when I want to see clients and when I want to do my visits. You get paid per visit. There is health insurance and dental insurance, which is great because I do need those things. Typically don't really work much weekends. If you do, it's because it's your choice to do so, or you might have wanted to reschedule a client for a Saturday, but that's not all day. It's nothing overnight that you have to do. Only con to it is that this company doesn't reimburse for mileage, but they pay their part-time people more money per visit, so that covers that amount. But it's like an independent job, really. You're pretty much on your own. You go visit the home with the client, do whatever documentation you need to do, and you go on about your business to the next client, or however you have yourself scheduled. So it's great. It's exciting. I have not officially started yet, but my orientation and things like that will be starting next week. So I'm looking forward to that. I think that I'll be much happier to have more flexibility and more freedom with things. And I did not give a 2 weeks notice. I know that's horrible, you guys, but don't judge me. But I just have learned over my years of life, my short amount of time on this earth, because I'm 28, but I have just learned that if something is messing with your peace, that you have to correct it, because nothing is more important than your peace and your mental health. I'm telling you, especially when you have like a strenuous program that you have to go through. You have things to maintain at home, family obligations, stuff like that. Nothing is more important than your mental health, because you have to take care of yourself first before you can take care of other people. And sometimes we all fall victim to taking care of other people more than we take care of ourselves, and then we suffer, and the care that we give or whatever else we do suffer. So I got to a point I just could no longer deal with the stress, and I had to not go back. I had to not go back to the job, and I, had to, give my reasoning and send something in writing and stuff to let them know. But I just could no longer do the stress. And another thing that I learned about myself in this go around is that I'm not a hospital nurse. Everybody is different. Some people thrive on like the hustle and bustle. I do not. That's just not something that I like. I felt like my care that I was giving was suffering because of low staffing levels and things like that. And I didn't think that it was fair to patients. And I honestly didn't want to be a person to support that. You support big business and making, money for a company, but they're low staffing you. So you can't efficiently take care of everybody like you would want to. And that's not a type of place that I really want to support. And unfortunately, that's a lot of healthcare now. That's how a lot of healthcare facilities operate, and it's very unfortunate to patients. It really is sad. And that was like another thing that I saw with my dad and his care that he received in the hospital as well. And this was a whole different system, but there was some times where things could have been a little bit quicker, or things could have been more efficient, but because the nurses didn't have all the resources and people that they needed there, things suffered. So I'm now at the point where I'm like, yeah, I just want to be somewhere where I can be like more one-on-one with patients, more hands-on. If they have a question, I don't have to feel rushed or anything. I can look up stuff for patients. I can take my time to educate patients and make sure that they really don't have any left questions or concerns. My hands won't be as tied. And then especially when I become a nurse practitioner, my hands won't be as tied with things. I'll have more freedom and more power to do certain things and more say so, because I will not lie to you guys. Once you put on a white coat, I don't care if you're a student or not, when a patient sees you and you have on a white coat, and some people might disagree, but once you put on the white coat and people see you, there is a certain respect that you get from a lot of people. There's a lot of more trust and respect that you sometimes get from people. It's amazing. It is. It's crazy. And I'm really trying to get used to that. But yeah, that's pretty much what's going on currently. So new job chapter, have a break from school for the most part, just have a few more things to turn in by Friday. I may make some more videos, just general videos of some additional tips that I learned throughout my last clinical rotation, and just from school in general. And that's pretty much it.